And here is your host.
Good morning, Las Vegas, and welcome to A Healthier Tomorrow. I'm your host, Will Rucker.
And I'm Ciara Owens.
I'm thrilled to be joined by you. You are so fantastic.
As are you, Mr. Will Rucker. Let me tell you, every time I see you, it's just glowing. Like,
it's a good day when we're together.
It is. I love me some second and fourth Wednesdays, y'all.
Well, I'm so excited for today's show. It is packed with purpose, people power, and real community impact. We're shining a spotlight on a topic we both care deeply about, which is health education.
Yes.
And particularly how it's being used to build equity, support families, and my favorite thing is research.
That part, everything is backed, y'all. This is not just fake science.
Say that again.
Not fake science at all.
And I feel like this week is actually National Health Education Week. Is that right?
I did not know that, but I'm leaning into it.
Okay. Well, if it's not, it is now.
Hey, we claiming it, y'all. Every week should be Health Education Week. We need to be definitely taking care of ourselves.
Absolutely. Well, I'm excited because we've got two guests, and well, really three, but two sets. And one is really special because she's behind the scenes making this magic happen all the time.
Yes.
She wants to go second, so we'll hear from her in a minute. But I got to give you this shout and say thank you for making our show work so seamlessly.
Thank you.
So amazing.
Look at that.
So humble.
All right, we got a lot of content to get into today. But as always, the Healthier Tomorrow program is sponsored by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. Join us for the next Health District After Dark event on Thursday, October 23rd from 4 to 6 p.m. in the afternoon at Southern Nevada Health District. The topic is the state of Nevada's public health safety net. To sign up and for more information, call 702-759-0609. With that, let's welcome our first guest, Cristina Hernandez, who's a project manager at UNLV School of Public Health, and Rikki Jenkins, program coordinator for Nevada Lactation Hub. Good morning.
Good morning.
Good morning.
Good morning, y'all.
Thanks for having us.
Absolutely. We are so glad that you are here. So before we get into the topic, Cristina, would you just kind of introduce yourself and say a little bit about why you're here?
Yeah. So, like you said, Cristina Hernandez. I use she, her, ella pronouns. And I'm excited because we have been working on this research for the last 5 years now. It's an NIH-funded project, and we're really working with community and learning more about what's going on with maternal-child health, food insecurity, nutrition, breast, chest feeding, you name it. We got it.
All right. And Rikki, what about you?
Yeah, so I'm Rikki, as you said. I'm also a board-certified lactation consultant and working on, I guess, what we're going to get into today about this ARPA grant. It's a really large grant, and it's about increasing the lactation workforce and then, in turn, increasing our breastfeeding rates here in Nevada.
That is absolutely powerful. You spoke of the huge grant. Can you tell us exactly what the Earn FS project is?
Yes, I will actually let Cristina do that because it's a bigger project than my little program.
Yeah. So
don't downplay your program, Ms. Rikki. Don't downplay your program. That sounds like important work as well.
The Earn FS project actually kind of began, like I said, it's NIH funded, and it really stemmed from building community organizations to come together to talk about what is it that we needed in regards to research and services around food insecurity and nutrition. And through that partnership, we started talking about what were the needs based on what we were learning through the research that we were doing, but then also what the community was saying specifically to us. And so one of the projects that came out of that was this lactation workforce development program, because what we were noticing is that obviously we know that our breastfeeding numbers are low here in Nevada, and even more so when we talk about ethnicity and race. And so what we also know is that it's really difficult, particularly to get to the point where Rikki is as an IVCLC, because that is like that's the gold standard of lactation certifications, and it's really difficult to get there. And so we were trying to think about how would we be able to support that work to then be able to provide the funding for individuals who want to become IBCLCs and have a lot of barriers in order to become that, because they have to get, hours, oftentimes not paid, and it's around 500 hours. So that if you think about like having to work for free for 500 hours, that's really hard, and not a lot of people can actually do that, and the amount of time that it takes. So the Earn It Fez was kind of like the beginning part that then kind of spread out to these smaller grants to be able to support the needs of the community around lactation, but around also food insecurity.
Do you mind sharing, because you keep mentioning that like Nevada's breast and chest feeding rates are low. Can you explain why, or even what those rates are?
Yeah, there's many reasons why. That's like a big soapbox that I'll try not to get on.
I was like, get on it, because you are highly certified and credentialed to talk.
Well, yes. So our breastfeeding rates can be low for so many different topics, right? So we're looking at paid parental leave. I also service the WIC program, right? And so I also see moms go back to work as soon as a week later, and that's after a cesarean section. And so we're looking at how there's not a lot of protection, even though we do have lots of initiatives and things like that, but we don't see it on the employee level. A lot of folks just don't have that as a benefit. Support in the community, so which is part of the program, is there are a lack of lactation consultants available to everyone. We have about 115 in the state, and given the amount of births happen per day, that's not enough. And then we have them support.
I just want to interject that you said for the entire state 115, not just for Las Vegas.
No, in the entire state of
Wow.
Nevada. Yeah, so we absolutely need more lactation consultants, more lactation support. We need that community support as well as cultural congruence, right? And so it's hard to take advice from someone who doesn't know our culture, doesn't know why we may or may not want to breastfeed. So it's really important that we also have that diversity, which is also not there.
Wow. Yeah, I mean, the diversity piece is huge, but I think there's also just the understanding. So as I think about the future of kids in our state, there are so many needs they have, but it really does start with prenatal, but also once they're there. Can you say the importance, and just for our audience that may be thinking, well, I don't need to breastfeed, but what is the importance of it?
Yeah, so it's actually very protective. Breastfeeding doesn't get the love it deserves, but the breastfeeding is jam-packed with literally everything your baby needs from birth. And so if we're looking at, wanting to be protective, as we know that breastfeeding and breast milk is designed specifically for your baby. So only you can give the needs to your baby from your body, and your body produces it naturally. And also it's protective for parents, for the lactating parent. It's protective against ovarian cancer, breast cancer, which we know that Black folks in particular are disproportionately affected. And so also for kiddos, it's protective against asthma, childhood diabetes, and obesity. So it's really protecting your child's future and your future as a lactating parent. And so we don't get to hear about these things. We always look at breastfeeding as, it's a nice to have, or it's a luxury, but it really should be a human right? Like if we are wanting to breastfeed, then we should have that support and care to support that and what that looks like. And it looks like support in not only in the hospital or wherever you're giving birth, but it looks like community support. It looks like support from your family. So education is crucial. I know you mentioned prenatal care, and breastfeeding should be part of prenatal care. So I always promote to take a breastfeeding class while you're pregnant. Taking a class in the postpartum or trying to learn things when you have the baby is particularly difficult, and it's better to be prepared beforehand.
Absolutely. What's it? An ounce of prevention is worth a pound of cure? Is that what
Absolutely.
Yeah. So when we're talking about the breastfeeding, what is the length? Because you said some folks are going back to work as soon as a week after they give birth, which we know that's way too soon, but that's a topic for another show. For this show, I want to hear how long, like in an ideal world, would a parent be able to breastfeed their child?
An ideal world, well, actually the ideal world kind of exists if we look at other countries and how they support their families, right? We have paid leave in a lot of other countries. A lot of those countries look like paid leave for up to a year, if not longer, but depending on the parent choice or the location, as well as paternity. So of course we have maternity leave, but what about, our partners who also they just also had a baby too. We don't often include families we're always thinking about mom and baby, but we have a whole family that also needs to support, and they are crucial to that breastfeeding success and the healing success, right? Because we also think about bounce back culture, right? Which is super detrimental. And so we need to think about, the full family needs the support. Once the birthing person is no longer pregnant, it's all about baby. What is baby doing? But what does the family need to take care of that baby? Baby's needs are always going to get met because our, mama bears and papa bears are going to protect their cubs, but who's protecting them? Who's holding the parents in that crucial, life? No matter how many kids they have, they still need that support.
When I think about this conversation, I'm like, so some of these things are conversations for another day. Just how much is intertwined when it comes down to family and then social economics and just access to information and things.
I told you it was a soapbox.
And go off on it because it's just there's so many crucial things that we could ask and talk about. As you go through this, and we emphasize bringing the family in, who are the other collaborators that we really need to talk to as we move forward to increase our lactation numbers?
Yeah, so we have been super blessed to have so many partners in the community. I know I've been talking, so Cristina, if you want to talk.
Oh, no, you're good. This is your world.
But we have really been blessed because one of the hardest things about having and running a program is, again, like I said, community support. So looking at who is just as passionate, because we can't do it alone. So UNLV Pediatrics, special shout out to Dr. Simungan. He's super amazing with all that we put him through every day, which is really hard to find folks like him. He's truly a gem. And then we have the Healthy Living Institute, the Southern Nevada Health District. We have Heart and Soul Collective, a special plug that I'll put in, which is a nonprofit that me and Cristina are both a part of. And we do this, right? We are trying to combat the birthing disparities in Clark County. We also have, obviously, EarnFS team.
We have
Nevada
Renown.
Partners. We have Renown up in Reno. We have Anthem Wellness Center here. UMC Hospital. There's so many who's been really supportive and really wanting to see this program excel even past this grant was for 2.5 years, so it concludes next November. So even past there, we've had discussions about continuing and what that would look like, which is the most important piece, right? Because while we're doing this important work for these 2.5 years, that comes up really quick. It's almost over. And so what does it look like to continue and foster that support beyond that? We also, of course, have the Nevada Breastfeeding Coalition, which, is all about supporting the breastfeeding rates here. And so we're really trying to connect, and there's nothing that's too much connection. So
that's right, because communities are certainly stronger when we work together.
Yeah.
And Cristina, I'm really curious on your side, what is it that you hope to gain from the research and all of this amazing support?
It's really that piece of helping our community partners having the data, because we know that data is everything when we look at funding. And so really being able to provide that to our community partners who are doing the on the ground work around these issues, to be able to say, here's the need. We know on a national level what's going on, but this is what's happening on either a zip code, because we look at 5 specific zip codes, but then also we increase into Clark County, and then hopefully soon we'll be up in the north as well. And so really trying to provide that data so that we can say, these are the reasons why we need these programs, and this is how research is supporting that work.
All right. So ladies, if you had to sit there and say one thing for people that are either questioning lactation or questioning, is this right for them, or even something for them in the future, what's a piece of advice or a word that you would leave with them?
I would say learn your origin story and talk to your family about, how they either did or didn't breastfeed.
Yeah, and I would say education. So not only should mom and dad or birthing person and partner look into it, but bring your family. Make it a family support event. Include everybody so we all know exactly how to support the breastfeeding diet.
And that's why we have support groups. So we have in English and in Spanish. And so that's another way that you can, come, and you can come while you're pregnant. You can come when baby comes. You can bring your whole family. It's free. We have a Spanish one at the Wellness Center, and then the English one at the Healthy Living Institute.
So if people want to find out more information, where do they find you?
They can find us on all our social medias. They can also go to UNLV School of Public Health website and get information there, or the Buccini Lab website.
All right. Thank you.
Thank you.
Recommended seasonal vaccines are now available at the Southern Nevada Health District Immunization Clinic. The Health District currently has updated COVID-19, flu, and RSV vaccines for eligible individuals. To schedule an appointment, call 702-759-0850.
Awesome. Well, look who's here talking on the radio.
Yes.
Lily, welcome to A Healthier Tomorrow.
Hello, good morning. Happy to be here.
So glad to have you. And before we get into the topic, would you please share a little bit about who you are with our audience?
Yes, absolutely. My name is Lily Davalos, and I am a health educator at the Office of Chronic Disease Prevention, which is a department inside the Southern Nevada Health District SNHD.
Awesome. And you are also a PhD student at
UNLV.
In the
School of Public Health.
That's right. Gotta shout that out. Yes. That's big. Yeah. So congratulations on that.
Yeah.
Good.
Thank you.
Absolutely. So I think I got this from you, which is the National Health Education Week is going on. So can you talk to us a little bit about that?
Yes. So the National Health Education Week, I believe, is the third week of October, and we're celebrating early, as we should. We want to celebrate whenever we can. This is a national initiative. It is hosted by various groups. One of them is SOPHE, the Society of Public Health Education, that recognizes this week. I think it's a pretty big deal because oftentimes we don't stop and think about the health educator impact within public health and the services that they provide to this community. So ultimately, this week is just to highlight the importance of health education and its role in improving health outcome and various different health topics.
Absolutely. I really think that the foundation of good health, one of the foundations or one of the pillars really is health literacy, health education,
Absolutely.
Understanding it. Because if we don't know what we don't know, then we don't know it.
Yes.
So this is incredibly important to me. So the Southern Nevada Health District has a lot of various programs that are supported by health educators like yourself. Can you share a few of them, some of your favorites?
Yes. To pick a favorite is really hard.
Kind of like picking a favorite kid.
Right?
Everyone's amazing.
Right. And I do want to highlight that because the Southern Nevada Health District is pretty large. It's a pretty big entity locally, and there's a lot of departments. And I want to give a huge shout out to all health educators that are doing the work in the community in various aspects. But specifically, I am with the Office of Chronic Disease Prevention, so I'll talk more about that program today. I know some of the things that we do include programs related to nutrition. So, for instance, one of the programs that we're offering now is a pop-up produce stands. We had one just yesterday. So ultimately, with nutrition, is about allowing folks in our community access to healthier fruits and vegetables and being able to get connected with these sources. So we also do collaborate with other partners in town to ensure that healthy food is accessible and easy to find. We also offer services related to diabetes. So diabetes is a pretty big topic here locally.
Yeah, for sure.
It is a growing public health issue nationally as well, and my department offers free diabetes self-management classes to folks. We offer them year-round. I have to look up the next ones that are offering, but they're free, and it does provide folks with information on nutrition, how to manage blood glucose, and there are various services that are provided there. Physical activity. That's another topic that my office touches on, and we have various initiatives year-round to promote physical activities and among other things too.
I love it. And one that I just participated in was an RTC bike share.
Yes.
And so that's super cool because, I mean, granted, I don't bike as often as I'd like. But now that you can go literally downtown and just rent a bike while you're there, get active, get healthy, and have fun while you're at it.
Yeah.
So when we go in and we really talk about this, we give our health educators so many flowers, well deserved. What are the benefits of having those health educators in your life?
I think it goes back to what Will said about knowledge and being able to know what you don't know, and that health literacy part. But I think, as that saying goes, knowledge is power. And I think ultimately we do want to provide folks with knowledge so that they can make the best decisions for themselves and also understand how to make little changes every day that can improve our health outcomes. So I think a big part is empowering individuals with that health knowledge so they can make the best decisions for themselves and their family. And I think about, to me, ultimately the big picture goal is to ensure that the healthy choice is the easy choice. Because sometimes there are barriers, right, to living your best happy, healthy life. And ideally, within health education, amongst other fields, you want to ensure that we can make these choices for ourselves. It is feasible, it's within reach. And a lot of that also goes down into advocacy. That's another big part, is advocacy. I know some folks in my team, I do want to shout them out. They are also involved in the state legislature and that policy piece. I know within my office we also work on tobacco.
Mm-hmm.
And they're very involved in the state legislature to ensure that we do have smoke-free spaces. So there's various different pockets of influence that we can work in.
I just want to put a plug in, 2 plugs, maybe 3. But one is for the smoke-free spaces. Mm-hmm. I mean, can we just call it clean air? Like, can we do that? Because that's what it is. That's what we're trying to get to. We want clean air, clean water, all the things. I mean, that should be basic, right?
Yeah.
Second one is, you said something that really sparked this for me. Knowledge is power. And what you are doing as a health educator is empowerment. So yes. I'm just thrilled about this, and I'm curious why you chose to be in health education.
Oh, you wasn't expecting that one now, Lily. Where are you?
I've been involved in public health for about 10 years now, but I've been involved in different organizations, different places here and there throughout the state. I've always stayed in Nevada because I love it so much. And for me, I just think about the community that I was raised in, and the fact that there wasn't a lot of resources. It's interesting because I knew about health equity before I had the words for it. Like, I experienced it. I knew about the challenges and why I would experience certain things, and my family kind of lacked certain services. And to me, when I first learned about public health, to me it just made sense. I'm like, absolutely, like, this is the field that I want to be involved with, even if it's just to address like something small within the vastness of public health challenges.
What's been the most impactful moment of your career so far?
Again, great question. I would say it would be my involvement with community health workers, specifically promotoras. I see that there is so much potential there, and just to see like folks in the community helping out other people and connecting them to these services, also empowerment, I think that inspired me so much, because I think that the strength, the resources, the ability is already there.
Yes.
Like, we have such like a powerful community. It's already there, but just to provide just a little bit more training services and to enable them to do their thing, I think it's just so empowering, because, we don't need somebody to save us. Going back to another
girl,
phase,
yes,
we have it within us, and to me that inspires me so much. I also see, like, for instance, with like my dad, he does benefit from a CHW, and I think about how much that's been helping him manage his diabetes. I feel like I'm just like seeing all of these things come together and just the potential for it, and it just, I don't know, inspires me to keep going.
See, y'all thought the show was on Power 88 just by chance. This is because we are empowering our community, because this is the People Station, helping folks to live healthier lives each and every day. As we close out, I want to give you kind of the last word. What is it, out of everything we've shared today? I mean, we've talked about the maternal health and the importance of understanding how breastfeeding is protective, and the benefits of having an NIH that actually funds research and supports programs. But what would you want as like your billboard to leave with the audience? She's like, you gave me all these questions I did not prepare
that
for.
She did not prepare. She said, I did not send that in the script.
Like in the billboard?
Like
on your billboard.
On my billboard? I would go back to the knowledge is power.
Love it. That's perfect. Well, thank you so much for being here. And again, thank you for all you do to keep us on the air. Ciara, we got some stuff happening in the community, right?
We have so many things happening in the community. So many of them have been mentioned throughout our time together today. One, y'all, really lean into the Regional Transportation Commission of Southern Nevada. It is Biketoberfest, y'all. So all month we are promoting cycling in Southern Nevada. There are going to be various events and activities throughout the month of October and workshops as well as bike rides. So go ahead and check out the Regional Transportation Commission of Southern Nevada for more information. We like to talk. They say we listen. Type 2 Diabetes Focus Group. Come share your experiences, y'all. Wednesday, October 29th from 8:30 to 10:30 a.m. It is an amazing collaboration. It's going to be held in person at the Southern Nevada Health District on 280 South Decatur Boulevard. A light snack will be provided, as well as an opportunity to really, really dive in diabetes-friendly pantry boxes. So to pre-register, please complete the interest form that you can find on GetHealthyClarkCounty.com. Also, y'all, 1 in 6 high school students have obesity. We talked about this last month. Please think about your kids as we can think about how we can help by shopping smart, cooking together, and moving more. Let's really think about building healthier futures. As Liliana mentioned earlier today, y'all, pop-up produce stands. One happened just yesterday. The next one is October 14th from 11 a.m. to 2 p.m. They help it happen 2 times every month. So check that out as well. We got time for some more?
Got some time.
All right, y'all. So Building Bridges to Health, HIV Health and Wellness Summit 2025 is happening Thursday, October 23rd. This year is focusing on youth and young adults. The future is now. So join us for a full day of workshops, presentations, and community connection designed by healthcare providers, advocates, and even anyone living with or impacted by HIV. There's also going to be an amazing event called Wellness Wednesday Fair that's going to happen Wednesday, October 22nd at the center from 9 to 11 a.m. You are going to have the opportunity to have vision and dental health screenings, HIV and STI testing, vendors, food, and refreshments. There's no RSVP needed. Everyone can be there. And remember, y'all, every single one of us have a status. Do you know yours?
Do you know your status? Can I get one in?
Yes, go ahead.
Power 88 presents a fun way to give to the station you love, the Late Skate with 88, this Friday, October 10th at 10. That's too late. 10 p.m. Sorry. That came out. This Friday, October 10th at 10 p.m. It's a good time. 10, 10, and 10. For a nominal donation of $25, skaters and non-skaters right at the Skate Rock City at 4680 Boulder Highway. Come out and celebrate 53 years. This is adults only, so come and party for a cause. It's a fundraiser. That's going to be some fun.
That is going to be some fun. Well, that just means you got to take a nap. You get off work, take a little nap, get dressed, and then go. You're real energized, and you're ready for something after.
All right. Well, this has been A Healthier Tomorrow. Thank you so much for tuning in. I'm Will Rucker.
I'm Ciara Owens.
And as we always remind you, you are not just a drop in the ocean. You are the entire ocean in a drop. And what you do matters. So live compassionately.
Have a great Wednesday, y'all.
Download the